Good day everyone, I am Zxiakira C. Prodigalidad from Nursing 216 and I am here to discuss and demonstrate the proper hand washing procedures and techniques. So why are we doing this hand washing? We have to remember the 5 moments of hand washing. First is before touching the patient. Second, before clean or aseptic procedures. Third, after body fluid exposure risk. Fourth, after touching the patient. And lastly, and the 5th moment is when after touching the patient's surroundings or environment. We are doing this so that we can eliminate the bacteria or viruses in our hands when we are taking care of the patient, and also to prevent the further spreading of the bacteria, viruses, disease in our healthcare environment. So first, we have to assess our hands. So as we can see, we have to keep our nails short. We also have to remove all the jewelries and accessories in our hands so that we can prevent further contamination. And also, we have to check if there are skin injuries in our hands, like cuts, lacerations, and abrasions. So now, we have to prepare our materials. So preparation of materials is done so that we can do it systematically. So we have to check if there is a tissue, trash bin, a easy reach sink rather, and also our antibacterial soap. So now we can do the hand washing techniques. So now that we are done with the introduction, we can now proceed with the proper hand washing techniques or procedures. So we have to check our materials in our environment. So first, there is a tissue there is antibacterial soap or sink, and also if you have an orange wood stick, that is better, but we don't have any here. And also, we have to check the space between our uniforms and the sink because this area is considered to be contaminated. We also have to push our wristwatch back to our elbow there. And also, we have to check the water's volume to avoid any splashes because the splash of the water, if it touches our uniform, it will be contaminated, and we have to change our uniform and also repeat the whole process. So now that we checked our environment, we can now begin. So first, we have to wet our hands and grease thoroughly. So we also have to make sure that we are keeping our hands and forearm lower than our elbow. Next is we have to apply the soap or antiseptic and rub hands palm to palm. Next is we our right palm over the left dorsum with interlaced fingers and vice versa. Next is palm to palm with fingers interlaced. Next is the back of finger to opposing palms with fingers interlocked. Next is the rotational wrapping of the left thumb clasped in right palm and vice versa. Next is the rotational rubbing backwards and forwards with clasped finger of right hand in the left palm and vice versa. And after all of that procedure, we can now rinse our hand. We also have to keep our hands and forearm lower than our elbows. Next is to dry our hands thoroughly, fingers to wrists, and also our forearms with a paper towel. So if it got too wet, we have to discard it. After drying, so we have to use this paper towel to close the sink because we have to avoid reaching with our hands to the sink because it will become contaminated as well, and we have to repeat all of the process, so we have to discard this tissue. And by that, we can evaluate our hands, make sure it is thoroughly dry, and also observe if there is any dirt that is not removed. So we have to repeat the process, and that's it.